Assalamualaikum and very good afternoon to everyone. Okay, continue from our previous class. Today I will talk to you about muscular fitness because as you remember that I've talked about cardiovascular respiratory fitness as part of the general exercise prescription guideline that you should follow. So the second component in your physical fitness component is muscular fitness. Okay, muscular fitness is one of the essential components of exercise training programs in our field. So meaning that you have to really not just looking on how to improve fitness of your heart, but also your muscle as well. So muscular fitness, it can be weightlifting, for example, like you can do like gym exercise or using all devices or all equipments. And another one is free weight. So meaning that you can actually exchange between one to use weightlifting using weight or free weights. Okay, free weight meaning that it can be your body weight and also use the environment like walks on the stairs or do squat on the stairs or lunges and so on. Okay, number three is about how the important component in muscular fitness is to improve strength, endurance as well as power, because muscular fitness here cover all components. Okay, so the goal of heart related resistance program or weightlifting programs is to maintain fitness. So then you can perform activity of daily living. So that's why it should be integrated in the fitness program for your client. Manage and to attenuate or prevent chronic disease. So you have to change the stigma among your client that weightlifting is not actually become like bodybuilders or bodybuildings, because you need to actually do some weightlifting so that your muscles can prevent from increase more fat. You can reduce, for especially elderly, you can reduce from sarcopenia. What is sarcopenia? Meaning that someone who have increased more fat due to the age factor among elderly. So from weightlifting, basically you can prevent this process. Okay. So meaning that weightlifting is not just lifting the muscles, lifting the weight for the muscle, but actually it's good for the health. Okay, I will explain this further, the benefit of doing weight training program in rehab. Very important with increasing age, because when you are young, your body are very lean, especially among people who have different body type. Like if someone who have like big fat body type, then it's difficult to have muscular or lean mass. But some people like ectomorph and so on, they born with it, and then you see that when you are younger, you are not so fat. You are sometimes, some of you are thin. So meaning that muscular fitness are referring to the muscle mass influenced by the age. So when you are increasing your age, definitely your muscle muscle composition will drops progressively. Okay, so it gives information that when you train your muscle, basically it's important that can be linked to your age as well. Okay, let's move on to next slide. Okay, in this box, it's basically I get it from ACSM, the old books, but I think there are new books now. But you can use this as a guideline for healthy adults and when you want to design a resistance training program. So number one, you can see that clearly. So when you're designing a resistance training, you must focus each muscle groups. So focus on the big muscles. Okay, you can. I think you learn this with subject like strength and conditioning. You need to follow the sequence principles from big muscle to small muscle. Okay, so it gives impression that if you train big muscles, so you will use a lot of energy, so your muscles will we perform more physiological response rather than small muscles. So that's why it's been recommended by ACSM. You need to focus big muscle, okay? So you can plan whether you want to start with 2 to 4 sets. For example, you plan to work on the chest, your pectoralis major. So definitely you need to focus on this big muscle for 2 or 4 sets. Okay, don't go beyond than that. So then, because you know when you train your pectoralis major, the big muscles, they always come with secondary agonist, and also come with synergist muscle and the big antagonist muscles. So it gives impression that if you train big muscle, so you will get what they call that, a good trait with the other muscles as well. So don't work with small muscle and then follow with big muscle, because then small muscle will influence, as a synergist muscle will influence the big muscle to perform well. Okay. The resistance training, number 2, should feature exercise around 8 to 10 exercises with multi-joint exercise, or what they call it as a compound exercise. I give you an example, like if you go to the gym, there are many types of multi-joint exercise you can perform, like shoulder raise. Okay, this is considered as a multi-joint exercise because you involve the glenohumeral joint. So it's not just your anterior deltoid will work on, it's also involve your trapezius, your rhomboid. So you can see that when you perform multi-joint exercise, more muscle recruitment will be used, then you will gain more benefit from that. Okay. So you can start number 3. You can see that each major muscle group should be trained at least 2 to 3 days a week. This recommendation may be accomplished per week or with greater numbers of shorter sessions using a split body, lower or you can change with upper body approach. So when you only selected muscle group are trained each session. So it gives impression that you need to play around with your frequency, okay? Frequency of the training in the week. So, but do not just train once a week, because it doesn't give much benefit for that. Because if you have big muscle group, you need to try to play around with, okay, upper body. You can rest. You can perform Monday with a big muscle in the upper body, especially in frontal region or frontal plane, which is your pectoralis major, your anterior deltoid, and your abdominal. So each cover a lot of muscles. So then you rest on Tuesday, and Wednesday you can choose back muscle, upper body more on the frontal posterior plane, which is your rhomboid and so on, and then rest one more day, and then Friday you can start with lower body exercises. So that is how you can plan your exercise. Okay, I hope you get a clear guideline that I try to simplify it. Number 4. So remember that one thing, we have a guideline. There are many types of guideline, but ACSM recommended about 8 to 12 repetition to be performed for each set that you selected. So don't go beyond that, because I think that is not what recommendation. There are some reason why they choose 8 to 12. One of them considered as rational, because 8 to 12 is not too endurance. That's number 1. Number 2, it's not too power, because when you set your range of reps, basically determine what type of training that you want to do. So if you choose less than 6, you know that it's more on muscular strength. If you less than 2, definitely you more explosive, so you cannot do that. More than 12 reps, you more an endurance exercise. So you choose. If you feel that, okay, you want to do maintenance, especially for the muscle hypertrophy and strength, you can choose, you can play around with 8 to 12 repetition. Although there is no clear research yet which one is the better and to one another, but I think this is a guideline given by the ACSM, which is you can use that as part of your training plan for your client. Okay. So number 5, you can see that all the individuals or all the clients should begin with resistance program at a very lower intensity. Yeah, it makes sense, because elderly, they don't have enough recovery threshold compared to younger client or like younger individuals. So you need to remember that exercise should go very progressive. So if you see that elderly, so you don't do that something exercise that consider it's too heavy for them. So go with lower intensity and try to have a look, closely observe that whether you can progress them slowly or not. Try to focus more on free weight first for the elderly. Sorry, yeah, what do you call it? Body weight exercise, okay, functional movement, which is give more, more proprioception improvement first before you go with hypertrophy or AA phase. That is what I really want to encourage you when you want to describe program, assistant program for elderly. Okay. Next is each exercise should be performed with proper technique and include both lifting, concentric contraction, and lowering eccentric contraction phase of repetition. So now you can see that this is how you need to really help the clients. Okay, you need to educate them the importance of tempo here. Okay, tempo will give you more stimulus, okay, to the muscles. So that's why you cannot do very fast because there's no quality on the training. So what you can do now, the proper technique here, beside that, you need to teach your client about how to do a correct lifting in the correct tempo during the exercise. The proper lifting technique here is referring to the concept of basic biomechanics of the muscles. You need to remember that our muscles here work with joint, okay? So sometimes you feel that, okay, your muscles are really fully utilized on this range of motion, but basically it's not. I give you an example like your elbow. I know some people try to do, when they extend the elbow into the range and then they slightly rotate the dumbbell more outwards, they're feeling more eccentric on the bicep. But yeah, you feel the muscle, but remember one thing, that exercise is dangerous for your ligaments, especially on your joint. So you need to understand about this concept. I'm not teaching you biomechanics, but I know there are many do and don'ts exercises in the gym that people make mistake. So you need to have a knowledge about the biomechanics of lifting weight, because that is your forte, as a fitness specialist one day. You need to not just teaching them the proper technique, you need to explain them a basic cue, a basic technique that they can remember, that one day they can do themselves when they exercise alone. I'll give example that I think you learn this with some subject in strength conditioning. Squat, a proper squat. There's a lot of trainers out there make big mistake, especially they performing a squat. They don't understand about the joint, but they're more focusing on how they feel it in the muscle. That's good, but remember one thing, not just feeling in the muscles, but you need to reduce the risk, which is your joint. If you do fully squat and then the squat actually hurting more on your knee joint, so doesn't give a lot of benefit. They give benefit to the muscle, but at the same time, the risk will increase to your joint. So you will get not just muscle hypertrophy, but you get the joint injury as well. You develop this for a long period of time. So that's why proper technique is a crucial here. So that's what you learn in sports science. You need to really understand this, because our joint, our muscle, they are working each other's. So as one unit. So biomechanics helps us to also to teach your client the safety way of doing exercise. Okay. All right. Next box. This is also important while performing a repetition or liftings. A regular breathing pattern should involve exhale during lifting phase and inhale during lowering phase. So the point here, you try to avoid Valsalva maneuver. What is Valsalva maneuver? Valsalva maneuver is someone who lifting weight, they hold the breath all the time. This is what people do in the gym. They do not know the impact of doing this. Yeah, if you're young, it's okay, but if your client are, a bit older, so maybe they have carry some risk factor like hypertension and so on, it's very dangerous, because you block your blood goes to to your brain and to the muscle. So the most important here, breathing, inhale and exhale goes to prevent from something that dangerous to your health. So that's why inhale and exhale will help to improve the force when you're lifting the weight. Okay, so make sure that when you're asking them to lift the weight, like for example, like bicep curl. So what you can do, hold the breath a little bit and then inhale and exhale. So that is how you do. There's so many ways of doing exercise. So one day I will show you in the video how to do proper technique during lifting a bench press, for instance, with your breathing. Okay, next. So if you notice that your client improve gain in the muscular fitness, for example, strength, because according to research, your muscle strength will improve first because there are acute adaptation on that compared to size. So if you start notice that they have improved the strength, so do not stay there. So this is what we call principle of progression. You need to have a progressive overloads on the muscle, so then you can have some benefit. Because if you do the same exercise for the same type of intensity, then you will see that first they progress in terms of improve the strength, and then they will plateau. Plateau means there's no improvement, stagnant, and then they drop. So because you need to remember, muscle is a cell. Cell meaning that they can actually grow. Okay, they grow when you give them enough stimulus. They will grow slowly. So grow slowly meaning that hypertrophy, muscle become bigger, okay, because of enrichments of muscle fibers in the muscles. Okay, next. So if you notice that and you start to talk to your client, that your client feel that, wow, my strength has improved a lot. So I don't want to do a lot more than this. So don't forget, if you do, they say that go with maintenance phase, meaning that just maintain with the same set of maybe you can maintain with the same set of repetition sets or load. You need to play around with this. Do not do something that all the time high intensity. Because remember one thing, I always talk to this about the goal that you want to help your client, not your goal actually. It's your client goal, which will be your first priority that you want to help them. So what you can do now, if you notice that they improve and they say, okay, I just want to have like this. So go with maintenance phase, help them. Okay, you can play around with set, reps, intensity, with loads, and different type of exercise, but you don't go too much because some clients, they have their own preference on their training programs. Okay, I think that is simple one on general principle guideline for muscular fitness. So I will go to the next slide talking about flexibility component. That is another one that people always make mistake because they overlook this. Sometimes I also make some mistake on this. Because we are young. So when I'm not young, but I consider still young compared to the others colleagues. I still forget about the importance of flexibility. But your job now is you need to create balance. You need to have all components need to be addressed in the fitness component goals. So remember one thing, flexibility exercise should be incorporated in your client programs. So what if we can do that? Because you know that, for example, like flexibility component, or they call it stretching exercises, it will help improve the range of motion. So when you improve your range of motion, definitely the muscles will have less tightness. You know, I won't say injury because there's not clear information about that. But what I can say, if your muscles are tight, okay, you have a big muscle because you train your muscle, but you forget to do stretching. So your muscle will develops with lack of flexibility. So you will see that the posture are very awkward. You know, you will see that the shape of the muscle also very tight. So all these things will contribute that someone would have chronic injuries, not acute injuries. I mean, acute something that over a sudden injuries happen. Acute means you develops repetitive movement, then you slowly develop the injuries, and that's what we call chronic injuries. So what you can do now, you need to integrate the stretching or flexibility exercise. So then it will help to improve performance, because our muscles is like, it's like a rubber, you know. When you train them, they become very flexible, so they can produce more performance, you know, like power, strength, more flexibility, so they can have a very flexible muscle. So when you say flexible here, it's not like gymnastic. Flexible means you can have the ability to move your body without feeling discomfort, you know. Because you can see that, I give example like bodybuilders. You see when they have a big muscle, they don't do stretching, so you know, you see their posture are very awkward, they're very tight. So the tight muscle here is very discomfort, because the muscle are so heavy, you know that, because it's cell, they grow cell, so quite heavy. At the same time, you need to move. So that's why when you feel discomfort, so I think you are not satisfied with your health when you feel so tight and then so inflexible. So when you standing for a long period of time, you feel your muscles start to twitching, you know. So that kind of thing or feelings are not very helpful. So you need to address the flexibility exercise incorporated with the training session. But don't go too long. Recommended by SASM is 10 minutes at least. Go with big or major muscles group to do stretching. Okay, you can perform at least 2 to 3 days a week, because flexibility will have progressive reduction and more quicker than the muscles. What do you call that? Decrease the outcome. So someone who are not performing that, then they can go very quick, become like they are normal before this. So what I will advise that the maintenance is important here. So you need to start educate your client to do stretching all the time. Okay, not just focusing on your session. What you can do, try to educate them, provide a lot of information that the different exercise. Nowadays we have so many sources you can use, website, you can ask them to Google, or you provide links about what exercise that you are recommended them to do at home, so you can do that. Because stretching or exercise like this, they can do anytime, anywhere, while cooking, while gardening, while before sleeping. Okay, you can do some simple stretching, watching television, play with the kids. You can do a lot of things. Okay. 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 I just want to make some a clear overview about the key point of doing stretching. So remember one thing: stretching exercise can be most effective when the muscles are warm. So that's why stretching, do not do stretching, especially dynamic stretching, while the muscles are very cold. So for example, you want to go gym and you suddenly jump. You jump and then do like, stretching muscles, like a power stretching and so on. I think will be not appropriate. So what you can do now, you can start ask them to walk, fast walk, let the body warm, and then progressively start with some simple stretching exercise. So then you can feel the more effective way. Because if you stretch your muscle during cold, it's like a rubber, it's just about time to break. So it's not recommended to do that way. Okay, that's why stretching more focusing after the exercise, basically, because the muscles are still warm, and then it's really good to reduce the waste product to the muscles like lactic acid and so on. Okay, stretching should perform before or after conditioning phase. Yeah, as I mentioned earlier, but try to limit some stretching. I give example like people before they start jogging or playing soccer, they just do static stretching. I think that will be less appropriate. So what you can do now, start with a dynamic warm-up. Warm-up is not the same as stretching. Warm-up is warm-up. Okay, like fast walk, you can do zigzag running, you can do that kind of activity, or calisthenic exercise, which basically can improve your body temperature. Okay, so you will feel more heat, and then you start sweating. So then you can start stretching. That's what difference between warm-up and stretching. Okay, stretching following exercise may be preferable for sports, which muscular strength, power, and endurance are important for performance. Yeah, exactly. If you want to lift the weight, so don't stay away with heavy weights So you do simple, you can do a very specific stretching related to or mimics to what you want to do next. I give you an example. If I go to gym, I want to do bench press. So if I lifting a weight, like a very light weight, so that is considered as my warm-up set, okay, warm-up set. And I try to mimic that as part of my, as mimic of the movements as part of my warm-up. And then I can just stretch, I try to incorporate with stretching static so I can start doing exercise. So it depends on your, how you put in place about your stretching program. It doesn't mean that you have to do like very general stretching. It depends how you want to design this. For example, like I mentioned just now about if I want to train my pecs, my pectoralis major muscle, so I want to do bench press, so I can do with simple barbell, lifting with no weight as part of my warm-up set. And then I do some simple stretching. It can be active stretching, it can be static stretching. Okay, so then when I say, okay, this is my counted set, so I can move with counted set as part of my training regime. Okay, stretching may not prevent injury. As I mentioned this many times, no. If you can get injury anytime, even though you are flexible. So you see athletes, they do stretching, they are flexible, but they're still injured. So meaning that stretching may not prevent injury. Okay, do not misleading. Okay, what the reason of doing stretching is there are many. I think I already discussed this with you. Stretching is good for your muscle. You can reduce muscle tightness. You can reduce muscle DOMS periods, daily onset muscle soreness. So you can able to have a good posture and so on. All right. So you can basically, if you want to perform stretching, you can do every day. Basically, if you don't have time, you can do 2 to 3 days a week. Okay. So there are many types of stretching. So you choose either static, dynamic, active, ballistic, PNF, dynamic range of motion. So there are many types of stretching you can choose. But I think if you want to if you want to learn this specific training on stretching, I think you learn with in the subject of strength and conditioning. So basically the same point, stretching should cover more on major muscle tendon groups of the body. Okay, major meaning your shoulder joint, your hip joint. Okay, this is all major. Okay, your hip, your back. Okay, this kind of muscle is actually, if you stretch, so it will help more what do you call that, flexibility. Okay, while you are doing exercise. So it can be more than 4 repetitions per muscle group. Okay, it's recommended by ACSM. Okay, ballistic stretching may consider particular for person who sport activity like ballistic movement. So ballistic stretching, like in football they jump, heading specific to the soccer game. Then you can incorporate that, but try to not put yourself in that way unless you know your client well. If you want to do ballistic stretching, because ballistic sometimes are not safe, because when you jump, sometimes people who are elderly, they have carry a lot of bone problems like OA and so on. So I think will less be effective to do that. Last is a 6-second contraction followed by 10 to 30-second assisted stretch is recommended for PNF technique. So that is what recommended by ACSM. So you see that about 30-second assisted stretch, the PNF. Okay, PNF is proprioception neuromuscular facilitation. I think a simple name they call power stretching. So you assisted, give force, and you again the force, you break and break with some interval rest. So I think you learn this with the subject. But if you can incorporate that, especially after the exercise, which is I think will be very effective for your client. So next will be neuromuscular exercise also. This, when you're talking about neuromuscular, is more referred to proprioception training or balance exercise. Okay, because when you are become older, so you lost the neuromuscular control gradually. So that's why fall injuries and so on has been affected among elderly, because they reduce their motor neuron discharge to the muscle or to the brain. So there will be acceptability, the brain to the muscle, muscle to the brain will reduce, or spinal cord will reduce. So when all these things reduce, definitely you will gradually decrease your balance, because of especially muscle have less communication to your central nervous systems. So when you have less communication, you feel less awareness. When you feel less awareness, definitely the brain will lose the vestibular and so on. So at the end of the day, fall injury can happen. So it depends. If you are facing with elderly client, yeah, I would recommend you go with, you will incorporate with neuromuscular exercise. There are many types of exercise you can do that. For example, balance with Bosu balance. You can do proprioception training, more on cognitive, where you try to isolate your focus between your muscle and your brain that you want to communicate, to put attention on, like isolation of the bicep, isolation of the calf, isolation on the quadriceps, where you want to try to develop back all this bridge between the muscles and the peripheral muscles and the brain. So proprioception training helps to improve the awareness of the muscle. So that's why it's more preferable for the elderly groups of doing this. So recommended 2 to 3 times a week. So you can include that. Also, in we are Asian country, Tai Chi, Pilates, and yoga is part of our culture. So you can do that. I think Tai Chi, Pilates, and yoga offer additional benefits to the person who are doing that, because these exercises are very low intensity, and also improve the oxygen supply to the muscle, because when you do a lot of resistance exercise, your growth hormone more secretions to the blood, so sometimes they become thicker, so the blood pH will drop because of the thickness of the myoglobin and so on, and so a lot of physiological changes happen when you do moderate to high intensity exercise. But when you perform Tai Chi, Pilates, they are more, isometric, they have less movement, they control breathing. So all these exercises have a very low blood pH concentration when you perform it. Even though there's no clinical research on that, but I believe that exercise that have less movements or slow movements will have benefits to your body condition, because if you're lifting weight all the time, there will be wear and tear to your joint and to your muscles. So I think that you need to balance with all this simple exercise. So exercise program supervision. Okay, this is very important. CSM general guideline for exercise program supervision. You need to make decision when someone who have health status that low risk. Yes, you can let them do the exercise. You can guide from the distance. However, when you see that they've been certified as a moderate or high risk, stable disease to do exercise, then you need to professionally supervise them. I give you an example, like someone who have diabetes, okay, a stable diabetic patient but still under medication, so they want to do resistance exercise. So your decision now, you don't give them some space like, okay, you do this exercise without my supervision. No, it's quite dangerous, okay, for this type of person. If they have lack of sugar level, so they can collapse, so they are prone more to the accident or to the to the injuries. So you need to know that. That's why I said risk certification is give you information whether the individual are high, moderate, and low risk. If they are low risk, yeah, you can teach them and try to guide them without professionally supervised. But if someone who are high risk, where they're known with heart disease before this, they put angioplasty 2 years ago. You know this. So clinically supervised. What is clinically supervised? So you need to monitor their heart rate, you need to monitor their blood pressure, you need to monitor many vital response and so on. So you need to monitor all the time. So in order that you want to ensure the safety of your client, because anything can happen for this kind of person, okay? Alright, this will be the last slide. What are the strategies to enhance exercise adherence? So adherence here is compliance. That is the most difficult one, because we can tell them so many great things about exercise, but to make them consistent with your programs, you must have strategies. So you need to plan that. Okay, you cannot give the same set of exercise and so on. That is I have talked about. But the most important here, you can give them some reward. So how to do that? Number one, you can see assessment of self-motivation. So assessment, you give them pre-assessment comparison to post-assessment. So it will arouse their motivation. Wow, I have improved. Although significant, is just small. Let's say you can monitor pre-strength when they lifting weight, and then you make after six weeks, you check the strength. Even the small things. So it will boost motivation to your client, and they definitely, you need to show them, to let them know, so then they can feel more motivated to maintain in your exercise program. So then they can keep living healthy living from what you have helped them, because a lot of people are relapsed from the exercise. So meaning that when they don't feel motivated, so they just go out, remove from the healthy living cycle. So they just stop doing any healthy living stuff because they don't feel benefit. Okay, they don't feel motivated. So you need to have assessment, so then we help them to motivate them. Okay, because assessment of readiness, okay, for exercise can be useful, like change between, as I mentioned, rate, sets, overloads, loading that you put, or type of exercise. Maybe before they walk, but now you are running, so you notice that their breathing pattern during exercise have improved. Before you can see that they are more breathlessness. Now they are improved breathing technique. So you need to address this to motivate your clients, so then they can maintain adherence to your programs. Okay. So number third is exercise programming and counseling should be client-centered. This is important. Don't do something that not client-centered. It should be client goals. You need to help you as a person that help them to achieve what they want, not you wanted them to achieve what you want. That is totally wrong way of doing exercise. Okay, you help them, you guide them, but to achieve what they want. Okay, it should be client-centered. If the client wanted to become healthy, to be functional, you need to go in that direction. If the client wanted to become, I don't want to be bodybuilders, but I just want to feel, I can have strength to do my daily course. Okay, you do that. That is your job. Should be client-centered, centered, not your centric. There are lists of suggestions. I think you can read this on the slide. I won't touch that because it's quite detailed. So I think it's a good recommendation made by ACSM. So you can follow that. Because remember one thing, you need to have strategy to help your clients. Because if you don't help them with a good strategy, we're afraid that they change their lifestyle, become more worse. That is not what we want. If they are from someone who are very sedentary, you want to help them to become active living. So from active living, you progress them to become more fit, something that they can embed it into their life. so they can do a lot of good and healthy things. But if you put them exercise, after 3 weeks they withdraw from your program and they relapse, become more worse. They don't eat well, they become very sedentary, they don't sleep well. So I think you don't help people. So one more thing, if you choose in this career or profession, your job is not just earning money, okay? Your job is to help people. So I always stress this since I joined UITM as lecturers. Your job here is helping people to become healthy, to become become more, fit. They can enjoy their life. That is your job. It's not your job is to gain money. Yeah, money is important. I'm not denying that, but don't centric yourself only for the money. Because if you centric yourself to get more profit, I think you won't help anybody, and in fact your program will be less effective because there is no, you don't feel the chemistry between you and your client. So that's why when the client comes to you and then talk to you, meaning that they are asking or seeking your helps. Okay, so you need to help them. Your job similar like a doctor's. If you meet a doctor when you're sick, you ask doctor to help you to become healthy. Okay, recover from your sick. It's the same person when it's someone who have ACL injury, okay, or obesity or osteoarthritis. So they're not able to move, they cannot pray, they cannot sit down, they always feel, sharp pain in the knee and so on. So when they come to see you, meaning that they're seeking some help. So your job here is to help them. Please, please, my class, I know money is important for you, but don't put that as your first priority. Your job are so noble, okay? So you want to help people, okay? Through exercise, through fitness. It's so noble work. Don't change that noble work become very opportunist, which is, I think, that is not the way you should do, okay? Your job now, you will see that someone who maybe before this are very, very, very bedridden, someone who are very sick, and then after few weeks, few months attending your programs, you help them and they recovered well. You see that it's something a bless that you see someone who are sick before and now they are, active and healthy. They can enjoy their living. So I think that is what you want to see. That is what you want to have from your profession. I think don't put money as a first priority. You can, I know money is important, but the most important here is your job is to help people. Okay, put that way. Okay, embedded this culture. You must have a belief. Once you help people, you share about the goodness of doing exercise. People will recognize you. Then the money will come. Okay, because everything that you do, if some benefit to someone, they will share this, they will spread this, they will tell people about, okay, this person helping me. So you can see that the money will come later. I know you don't, I'm not saying that I'm so, uh, try to say that I won't consider money, but I consider money as well. But the most important now, what I'm trying to say here, your job is so noble, so you put priority is to help people first through exercise. Then you can put money later or second, third. It's your choice, okay? Because when you do something that very genuine, very noble, you help people, I think the money will come later. So class, thank you so much. So I would like to take opportunity for ending this class to have thank you so much to all the frontliners, because we know without them, I think Malaysian will have a very bad situation, unprecedented with COVID-19. I know there have been among frontliners are facing a lot of challenges, a lot of high risk, because they can get the infected or contracted with COVID-19. So we pray to God that hopefully Allah or God will shower them with goodness and also heaven. Thank you, class. I see you um, next class with another chapter. Okay, Assalamualaikum.